Got 20 seconds. Come on, Amanda, go.
Keep moving, keep moving, keep moving. Good. Get those knees up. Explode. Good. Explode. Let's go. Up.
Rock forward. Let's go. One more. Go.
You are listening to the Fight Strength Podcast with your hosts, Phil Daru and Jason Burgos.
Hello again, MMA and fitness true believers, and welcome to an all-new Fight Strength Podcast. I, of course, am Jason Burgos, contributor for SureDog and MMAsucker.com, and this week is a bit different than the normal. On this episode of the show, we have a fill-in for Phil. I'm excited about this guest co-host, because in my humble opinion, the Fight Strength Podcast, as we know it today, probably doesn't exist without this man. He is a human performance and organizational leadership expert, adjunct professor, Golden Gloves winner. He's the lead boxing MMA coach at Legacy Martial Arts, Vero Beach, Florida, and he has worked with a bunch of top-level fighters like Brad Pickett, Jordan Young, and Matt Schnell during his long career. What does this man not do? Plus, he's just an awesome guy, a great friend. I mean, those are key things too. So, I mean, he is Dr. Paulie Gloves Gavoni, or call him Paulie Gloves if you're nasty. Paulie, what's going on?
Hey, brother. You forgot to mention that while Phil's hair looks pretty good, my hair is perfect, always. So
I will say I'm a much bigger fan of your beard than Phil's beard.
Thank you.
What's going on? How you doing tonight? I'm excited to have you on the show as guest co-host.
Oh, I'm stoked to be here, man. I always love chatting with you, man. Shooting the breeze with you, talking about MMA. Love what I do, and I love chatting with you and any chance that I can.
You got any interesting thing? Like, this is the part where Phil kind of brings up, talks a little bit about seminars, things he's working on. You got any fighters you're working with, any big fights coming up, anywhere, any promotion, any notable things, or even some of the talking engagements you might have coming up, maybe people in the Florida area or wherever can check out?
Yeah, a couple cool things. Well, number one is I'm working with a guy named Jordan Young. I really believe he's going to be the next light heavyweight champion. His main camp is in Coconut Creek, but he travels up to work with me at American Top Team. That is American Top Team in Coconut Creek, but he travels up to work with me in Palm Beach Gardens at American Top Team there. Dave Zitnik's camp, and I'm working one of his striking coaches. He's also working with Dia Davis. We're working on a long-range game with him. Jordan is just amazing, man. Incredible athlete. I can almost guarantee you he's going to be the next 205 Bellator champ.
Yeah.
It's fantastic. So that's been a lot of fun. Of course, I've got the amateur crew I've been working with, but I'm excited. I'm in the middle of working on a book. The book is called Deliberate Coaching. It's about the science of human behavior as applied to coaching. So that's under construction right now. That'll be out later on this year. Published by Learning Sciences International. So I'm actually collaborating on that with a very well-known behavior analyst, Dr. Nick Wesley. So it's cool, man. Staying busy. I like writing. I like sharing knowledge. I like helping people become better, and that's what's on deck right now.
I mean, what's cool about this too is that this episode of the podcast will be used for a future article we're pairing up together for Bloody Elbow. So I mean, that's a pretty cool thing too.
Well, man, I'll tell you what, dude. You actually helped me out in the writing world a little bit. You got me on with MMA Sucker a while back, and I appreciate that, dude. And I'm glad to be here with you years later. How many years have we known each other now?
I think it's crazy because it's weird. I saw the Facebook reminder thing they have. I think it was only 2 years, which it feels longer. When you meet cool people and get to know cool people that are good people, it feels like you're known longer, even if it's 2 years. But that aside, on this week's edition of the show, me and Paul will be joined by a leading figure from the Southern Florida-based clinic NovaGenix, and that man is Tim Bruce. He's coming on to talk with us specifically about platelet-rich plasma therapy. Now, if you aren't familiar with this term, most just call it by its acronym of PRP, which popped up in the sports news a few years back when aging athletes like Kobe Bryant and Alex Rodriguez underwent the process to extend their careers a bit longer. PRP is a pretty popular form of treatment to deal with injuries, but I won't get too much into it and let Tim answer the question on that. But, Paulie, how familiar are you with PRP treatment?
I don't know much about it. I want to learn more about it. If there's something that can help fighters recover to their baseline, it's not performance enhancing. I'm man.
Yeah, no, I mean it's interesting. I'm curious and I'm excited to talk to somebody about it because it is such a fascinating thing. Where I mean, on my basic knowledge, I think it's related to using your own blood, or I'm not sure if it's your own blood or other blood to help you heal your body. So it's fascinating, and we're gonna ask some interesting questions. But of course, I would also like to mention, if you dig our interview today, please check out all our other episodes with experts in nutrition and fitness like George Lockhart, Dr. Corey Peacock, Jake Bonacci, and Tony Ricci by finding our pages on iTunes, Spotify, Player FM, and iHeartRadio. Share, comment, give us a rating. Also, if you want to be interested in any sponsorships on the show, contact us on fightstrengthpodcast at gmail. Now, since Phil is not on the show this week, we won't have our traditional Ask the Roo segment. Sad for some, I understand, okay. But since we still have an MMA expert, I figured we introduce a new segment. And that segment is dubbed In the Corner with Dr. Gloves, where Paulie will answer some striking related questions from me. Now, my first question for Dr. Gloves is, you have taken on a few fighters well into their careers. For a fighter like, say, Justin Gaethje, who fought a couple weeks ago against Dustin Poirier, whose brawling style has brought him tons of popularity, but also some tough losses and likely difficulties later in life. Maybe there's a CTE fear element for someone who fights like this. How hard is it to change a fighter's style after they have had success with a style like that may not be beneficial for them on a lot of levels, including strategically?
That's a fantastic question, man, and it's hard. It's very hard. I actually worked with Brad Pickett, as you mentioned earlier, very tough fighter, a lot like Justin, right, brawling style. And I came in midway through Brad's career, and it's very, very difficult to change somebody's style when they've had such success with it. It's a great question that you're asking. Really, if you're going to make that happen, it's an ideal time for it too, because he essentially got in contact with punishment. He's used the style, he's done it twice in a row, meaning he's lost twice in a row, and so that might give him and his coaches the motivation to want to change it. But it's going to take a lot of repetitions in the gym to kind of breathe that out of him. One of the problems is you can't really replicate live fight conditions.
Now, in MMA, there are many fighters that are highly skilled offensive strikers, yet very few can seem to apply effective defensive techniques during an MMA fight as opposed to boxing. Are there elements of MMA defense that are much harder to do in this sport than in boxing, or is it simple as just getting better at fundamentals for MMA fighters?
So it's a great question. There's certain defenses in mixed martial arts that are very dangerous to apply, particularly a head movement, right? Slipping, rolling your head. Guys like Mike Tyson, Joe Frazier, they use that defense very effectively to turn a reach advantage into a reach disadvantage, right? By slipping inside, using that head movement, close the distance, and get off, some major hooks. But one of the issues in mixed martial arts is that if you move your head too much, you expose yourself to kicks, you expose yourself to knees. So that's part of the issue. Another part of the issue is that mixed martial arts will never be as fluent with their hands as boxers, simply because there's so many different techniques that you have to practice, right? And the way you build fluency, which is responding quickly and accurately, and something, a skill that's durable, that becomes very automatic, is just lots of repetition over time. And when you're dividing up your attention between so many different skills, you just won't have that level of fluency. And that's why you have fighters that become the best fighters actually become really good in a handful of skills, right? Fighters that try to become good at everything, they won't be successful in mixed martial arts. They might be well-rounded. They're called well-rounded fighters, but even the ones that are very successful that we call well-rounded, they're really good at a handful of skills, right? Because they get lots of repetition. They apply those successfully in drills and in sparring. So, those are a couple of the reasons. But you are starting to see more boxing-oriented skills. For a long time, Muay Thai was kind of the striking default for mixed martial arts. But you're seeing guys apply boxing very well, very effectively in mixed martial arts now. I think you're going to continue to see that improve. I'm excited about it.
Yeah, and I was actually gonna, when I was formulating the question for you, I was thinking I was gonna say like, oh, it seems like Muay Thai is the base for a lot of fighters, and it's boxing not used enough. There was an interesting thing I saw in an interview with Daniel Cormier where he was talking about it's harder to do the classic. Putting your hand up and kind of blocking with your gloves in MMA compared to boxing because you have this big glove to box with. Well, I mean to block with, while in MMA you just have the small gloves. Even on a simple level, is it even harder to kind of do those classic traditional blocking techniques, defensive techniques in MMA because of those weird little slight differences like gloves or how a stance is because you can't be in the middle stance and
It's incredible the nuances. I mean, those nuances make all the difference in the world. I mean, see things even like so when Mayweather was going to fight McGregor, which is just ludicrous that anybody thought that McGregor could beat him. All those nuances are very important. Like for example, like in boxing, you use shoes. That little bit of friction is a big difference than for what mixed martial arts use because they don't have shoes, right? So that makes a difference. In boxing, because the gloves have a little bit more padding, that little bit more padding, fighters work in like millimeters, man, very precise. The best fighters are very precise with their strikes. So that adds a level or that detracts from your distance. And because mixed martial arts, there's so many different ways to strike, the distance in mixed martial arts is actually greater than in boxing. In boxing, they stay right up on each other. There's more inside work. You don't see that type of inside work in mixed martial arts because somebody's just going to clinch you, knee you, or take you down. So that all makes a bigger difference. And that's why you see some punches are much more effective in mixed martial arts than they are in boxing. Like you'll see longer, loopier punches work in mixed martial arts, where in boxing, be seeing it as being sloppy. But the reason is the distance is greater because they have to avoid the takedowns, they have to avoid the kicks and all these things. So if you throw a big, long overhand in boxing, somebody's going to slip right in, maybe counter it. However, in mixed martial arts.
All right. So it is now time for our guest. In 2016, this fellow and his friend Andy Stock came up with the idea to open up the NovaGenix clinic. Along with this business, he has also been a teacher and is currently a second-degree black belt in Brazilian Jiu-Jitsu, having learned from instructors like Mike Bidwell, Sean Alvarez, Rob Gutierrez, and Rodrigo Mendez during his 20 years practicing the art. That very skilled individual is Tim Bruce. Tim, thanks for coming on the show with us this week.
No, thanks for having me. I've been, dying to get on for a long time because obviously a big fan. I love what you guys do. I love, all of Phil Daru's work and commentary. So it's absolutely my pleasure to be on here and a great honor. So thank you. Appreciate it.
All right, so I'll jump right into my first question. So can you just give us a little background story on yourself and your path toward developing the NovaGenix clinic and why you felt it was a necessary facility to open in the Florida area?
All right. Well, I'm not sure if it was a necessary facility, but it turns out it's actually been a very, very useful one. So I guess to start in the beginning, when I was in college, and this is 1993, that was the year of the first UFC, and everyone saw this little, like, skinny Brazilian dude just choking the living daylights out of people and in like a pair of pajamas. And this is the US, so we were like, it was bloodlust. The first UFC was literally like Mortal Kombat. And then here's this guy coming out with this just technique and skill and grace, and and it was like, how is this possible that like someone his size, who actually weighed the same amount that I did back then, how is he just beating these like monsters? And I ended up having a Brazilian roommate in college, and like all Brazilians, he knew a little bit of jiu-jitsu, and he showed us a couple of chokes. And then one day he had a cousin come visit us who was an actual blue belt in jiu-jitsu, and he was skinny dude. He was like 145 pounds, and he just, one night, we've been drinking and wrestling around, and he just put us in our place. Like what a Brazilian jiu-jitsu blue belt can do to someone who doesn't know jiu-jitsu is, it's terrifying.
Yeah.
So, after that point, I was like, I need to learn this skill. Unfortunately, back in 1993 and 1994 and 5 and 6, there was just no jiu-jitsu unless you happened to be in a few very lucky geographical regions. There was not a lot of instructors that were teaching jiu-jitsu. So one day in the University of Delaware, I saw this guy wearing a jiu-jitsu shirt, and he was like lifting weights. And I was like staring at him because I was reading his shirt, and he just, he was like looking like, why are these guys looking at me? And, he came up and he was cool because like most jujitsu guys are, and he introduced himself. I asked him, I was like, dude, I don't mean to stare at you, but like, do you train jujitsu? And he was like, yeah, and he just gave me the number and the directions. And I went, and that was in 1998. And my first instructor, awesome guy, his name's Mike Bidwell. He actually currently is really popular. You may have seen some of his videos. He does BJJ over 40, and he has some of the nastiest moves out there, and he's just really just blowing up. And so it's really cool to be able to see this guy. And it's like, man, that was my first jiu-jitsu coach. So I just started, training and competing, and it just spoke to me. I'm like, I'm not having someone hit me with a bamboo cane because my foot's 2 inches off center. I don't have a little Japanese guy yelling at me, punching me in the stomach. I don't have to do these dances and katas. It was a bunch of like, laid back guys that like to fight and choke each other. And I was like, this is great. So, after I graduated, I moved to New York, and once again, even back then, there wasn't a tremendous amount of jiu-jitsu. They had, there was Alliance down in New York City, but that was like an hour plus for me to commute, and Renzo Gracie's school. But once again, here I am like just out of college, and I'm like, man, I don't have the kind of money to spend to train in New York City, and plus it's far. But luck would have it, I was working as a waiter at a restaurant, and all of a sudden, like there's a guy had a jiu-jitsu shirt on, and I was like, oh my God, do you train jiu-jitsu? And he's like, no, but I own a gym and I got a guy that teaches there. And turns out that guy was Sean Alvarez, who was a former UFC fighter. He was a Abu Dhabi runner-up a couple years in a row. Just freak of nature. He was just strong, and actually the way he had gotten in jiu-jitsu was interesting. He was the personal trainer for the Sheik who started the Abu Dhabi Combat Club.
Oh, wow.
And he was training, doing private lessons with Nelson Montero out in California. And I guess the Sheik needed someone to practice on. And so Sean became his like practice dummy to work arm bars and stuff during his private lessons. That's how he ended up learning jiu-jitsu, and he ended up getting his black belt and just being one of the coolest guys. And I was fortunate to also have Rob Gutierrez, who's also teaching there. He's the head instructor at ECU in Queens, and he's one of the most technical jiu-jitsu instructors I've ever had in the gi. I mean, he was back in the day analyzing videos, moves, and positions. So, I was really fortunate to have some really good instructors. So in 2005, my wife and I moved down to South Florida. And, at that point, I'd been teaching jiu-jitsu in a high school up in New York. They gave me carte blanche. It was a Catholic high school, so they let me start a jiu-jitsu club after school for the kids. And I don't know of any other high schools that had anything like that at the time. So
my high school definitely did not have that in the Bronx.
No, absolutely. This was in Yonkers, so we were fortunate. We went to Toys R Us and got a bunch of those cheap puzzle mats, and they gave me like this huge art room, and we had to duct tape them together because they wouldn't hold. They were always coming up.
Been there. Yeah.
But fortunately, one of the girls that actually started jiu-jitsu, Bianca, she actually ended up continuing jiu-jitsu, and she's now a black belt. So it's just really cool when you can actually influence people and see them progress. But but I came down to Florida and I needed to find a place, and it was amazing because in New York, where we were, there was a few jiu-jitsu schools. Then you go down to Florida, they're everywhere. Jiu-jitsu, MMA, you got ATT, you've got this school, that school. You can choose. Every block, it seems, had one. And then once again, I think there's something to be said about fate and jiu-jitsu in my life. I'm in the grocery store, and some big Brazilian dude, wearing like a jiu-jitsu shirt and funny ears, I happen to also be wearing a jiu-jitsu shirt, and he started talking to me in these accents, and that was Rodrigo Mendez, who had a school He started his own school down in Delray, RMBJJ, and he had a school at that point in Boynton Beach, literally 2 minutes down the road. So I no longer had the excuse of like, well, time, distance, So I went, and it's an awesome group of guys, and they're a really good. It's a real good family environment, and those guys are a tight knit bunch. He's got a great program. He's got a bunch of black belts now that are training there and teaching there. So I ended up training there. I was his first black belt, and I started teaching in Jupiter. And I still teach in Jupiter when I can, when NovaGenix doesn't have me busy. But to get to the NovaGenix portion, one day I'm online, and I got approached on I forget what BJJ site it was, but Andy Stock, my partner here at NovaGenix, sent me a message. He's like, "Hey, listen, bro, I've just moved down to the area. Do you know of any good jiu-jitsu schools? I'm a brown belt, and I'm like, as a matter of fact, I do. Why don't you come and join us?" And he came in one day, and we became friends, and he started training, and it was phenomenal. So we stayed in touch, and then I guess what was this? Probably mid to early 2016. Andy and I were training one day, and he came to Jupiter, and we're sitting there and on the mats, exhausted, and he used to be a personal trainer at the IHP down in Boca. And I was like, "Oh, are you still doing the training?" Because he had actually got me ready for Worlds, and he got a bunch of my students ready. And I mean, he was an awesome trainer. I was like, "Are you still working at that facility?" Because it was an amazing place. And he says, "No, I'm selling Trimix." I said, "Trimix? What the hell is Trimix?" I never heard of it. It was a vacuum cleaner or something.
Like cereal.
Yeah.
Honestly, I wish, because I asked him, I was like, "What is Trimix?" And this is NSFW, if I'm not mistaken.
It could be. I haven't official, but it might be, yeah.
All right, so there. Well,
if you want to curse, just curse away.
So he goes. Well, this is basically his response. He goes, he's like, "Well, it's this injection that guys shoot into their dick so they can get hard and have sex." I said, "Wait, what?" Because last I heard, he was getting people in shape. He's a personal trainer, and now he's injecting medication into guys' penises, so they get erection. And I'd never heard of that anyway. So I said, "Wait, what did you just say?" And he's like, "So Trimix now, guys come in and they can't get hard, and I inject their penises so they can get around." I was like, "No, we need to go back a few steps. What are you doing?"
I'm never gonna look at Andy the same.
No, nor should you. Nor should you. But he kind of explained. He's like, "I work at this men's health clinic. We do testosterone replacement therapy and weight loss and erectile dysfunction stuff. And for some guys, Viagra and Cialis doesn't work. Maybe they have blood pressure. There's all these other contraindications where they can't take this medication because it could kill them, or maybe it just doesn't work." And I was like, "All right, makes sense." So it's like that's cool, but let's go back to this Trimix. What are you talking? He's got some really good stories with it too. But so he was sick of running these clinics, because he pretty much was managing 2 clinics, one in Boca, one in Palm Beach Gardens. He's like, I just want to start my own thing. And at that point, I was working, for a telemedicine company, so I kind of had, a good grasp. I was a former EMT. I was starting to understand a little bit about business and marketing, and he kind of told me a little bit about what they do, and I was like, this might be, a cool thing to, dive into. And so, we got together a whole bunch of times and worked out some of the logistics and came up with a business plan, and then came the search for the doctor. And once again, fate, always finds a funny way of popping up in your life at the most, unexpected and important times. And one of my best friends, he's actually the first guy that I've ever given a black belt to. I trained him from white to black. His name's Patrick Ryan. He is right now he's pretty much running the Jupiter Boxing Club and Jupiter Jiu-Jitsu. He's teaching the boxing clubs. He's coaching those guys. He's training the jiu-jitsu fighters. He's one of the greatest guys. he called me up. He said, "Hey, are you looking for a doctor still?" And we had a doctor, in our pocket, but he's like, my uncle, knows this guy, and he's looking to, kind of get back into that field of work. So I was like, all right, well, let's see what he's all about. And we met him, and that's Dr. Tim Sigmund, and he's quirky because he's a doctor, and he's just this amazing eccentric dude in his own right. He's got like that adult ADHD where his mind's going and he can't stop. But he's an encyclopedia. He is brilliant, and he started telling us about all the things that he does in medicine. He's like, yeah, I do all that stuff: weight loss, hormone replacement therapy. He's actually been doing TRT and HRT for years. So I was talking to him about it, and it was fascinating. And I'm like, all right, so that's great, but it turns out he lives like right down the street from the clinic. So I'm like, this is really like, this might work. He's, hey, not for nothing, but I also do PRP. I was like, PRP, what is PRP? He's like, oh, it's platelet-rich plasma therapy. And I'd heard of stem cells, and like that wasn't my area of expertise, but he started explaining what PRP was, and how all the treatments that he does, and I'm like, that's that works? And he was like, hell yeah, it works. Are you kidding me? He's like, it's amazing. So did a little research on it, and I mean, as a jiu-jitsu instructor, I know I could probably not stop counting the number of people that I have that have some form of injury. You name a body part, I know someone who's got an injury. And there was, one of my former students, great guy, just beat up. He was a white belt that liked to go 1,000 miles an hour. He's fearless. He fights MMA, but he just one speed, and that's all out. And as a result, I mean, he had shoulder, elbow, knee, ankle, you name it. He was messed up. So we had him come in. And he was our first PRP patient, and because he had been off the mats, I hadn't seen the guy for 3 months. And Big Mike, one of our friends, he was like, "Yeah, Kyle's messed up, bro." I was like, "What do you mean?" He's like, "Dude, everything. His wrist, his elbow, his shoulder." And I mean, he's the kind of guy that you'll roll with, and you'll hear things like pop and snap and tear, and stretch, and I'll be like, I'll stop it because I'm like, it sounded like someone tore fabric. I'm like, dude, like, you're not wearing a gi. Like, what was that? He's like, "Oh, I think it was my shoulder, coach." I'm like, dude, it's not normal. Are you okay? He's like, "I think so. Let me check it out." He's like, "Nah, I think it's messed up." I'm like, yeah. But he came in, and the doc, we did PRP on him, and a couple weeks later, I go into the combat club down in Lantana, and there he is, like rolling, like, and just tearing it up, and I'm like, holy shit. He's like, bro, he's like, coach, he's like, you understand, like, I'm cured. I was like, really? Just like that? It worked out. He's like, oh, I feel great. And sure enough. So as it turns out, Gilbert Burns was, the head jiu-jitsu coach. Him and now his brother Herbert Burns are the head jiu-jitsu instructors at the combat club. And Gilbert saw what happened with Kyle. And Gilbert approached me. He's like, "Team, man, my arms, he's not working so good," and he had injured himself, I guess, in wrestling practice with Greg Jones, and he couldn't show techniques, he couldn't show moves, like his arm was like really, really messed up, and he's a UFC fighter, so that's his body is his living. So these guys, they can't be injured. If they're not training, they've got some serious problems. So he came up, and that one made me nervous because I'm like, Kyle was a guinea pig, and if it worked on him, that's fantastic. If it didn't work on him, he still has his job and he's still, a normal dude. But if this doesn't work on Gilbert, who's world champion in jiu-jitsu, a UFC fighter, head coach, I'm like, man, this, that's not going to be good for A, for business, but B, like, it's going to be hard to show my face around the gym again. So as it turns out, I saw him a couple weeks later, and I was like, oh, here we go. I'm like, hey, how you doing? Biggest smile on his face, and just that warmth, that like that just genuine, like, good-natured, just I guess that Brazilians possess. You know, he comes up and he's like, gives me a hug. He's like, man, team, it feels like I have a new arm. You know, and I was like, oh, thank God. You know, he's like, I'll be honest. After 1 week, I was not so sure. You know, he's like, I don't know if he's doing much, but after 2 weeks, he's like, I feel like I have a new arm. And back to training and fighting, and you know, that guy's been on a tear. He just won his second UFC fight in a row by like a vicious knockout. So it was, you know, it was really cool, and that opened up the floodgates. You know, all those guys started coming in. So you know, but Andy and I, you know, the genesis was in 2016, and we opened this up, and you know, it was just going to be kind of like a general men's health clinic. But after we learned about what PRP was, and then eventually stem cell therapy, you know, we started really, you know, marketing towards it and trying to, you know, help out some of these fighters and these athletes and their coaches. And I mean, I would say at least 50% of the guys that we treat, you know, it's athletic injuries, and they're usually fighters and athletes, whether it's jiu-jitsu or MMA. And it's been, you know, it's been a lot of fun because they're some of the best people that you'll ever meet in life. They really are.
So Tim, what exactly is PRP, and how would somebody know if it was a treatment for them, whether it would be athletes or just the average Joe?
So PRP stands for platelet-rich plasma. And without trying to get too technical, and to be honest, I'm not sure I could get that technical. The fact is, you know, when you get hurt, when you get injured, say you get a cut, for example, the blood will rush to the cut and it'll kind of congeal. And what happens is the platelets, you know, will kind of dry that blood up and it'll form a scab. And in your blood, all the platelets, they release growth factors, and cytokines is what they're called. And basically they're cells that recruit what your body needs, the cells that your body needs, the stem cells, to, you know, merge to the area and start repair. Because it's more than just skin. You've got your skin cells, you've got your subcutaneous fat, you've got sometimes muscle, tendons, ligaments. They all need to be repaired by different cells. So the platelets, they release the growth factors, you know, when there's an injury, and they do the directing of the body on a biological cellular level to start the process of repair. Now, a typical blood sample contains anywhere from, we'll say, 100,000 to about 400,000 platelets per microliter. PRP, by definition, is a minimum of 1 million platelets per microliter. So you're jacking it up. And the way we do that is we take your blood, you know, we'll draw your blood. Usually for us, we'll typically draw about 50 cc's, which is, you know, like we'll say, you know, half a can of Coke about, you know, it's a decent amount of blood. Mm-hmm. We'll then put it in a centrifuge and spin it. And we have a state-of-the-art system that we use that is unlike what 90% of the other clinics out there are using, because it's better. I mean, the thing is, it's amazing. It breaks down and separates the platelets in the blood. And what we do is we remove the red blood cells, and then we're left with what's called the plasma-rich, the platelet plasma suspension. So it's kind of like yellow and cloudy, and then we spin it again. And the cells, what happens because of density on the bottom, we're left with about 8 cc's. So we go from 50 down to about 8. So we get rid of 42 cc's worth of the blood that we don't need, and we're left with 8. And within that 8, we're usually left with about 8 billion platelets. Those are all the cells that your body uses to heal you, whether it's a cut, whether it's a muscle tear, whether it's a ligament or tendon sprain. You know, it could be almost any type of tissue. And the you know, the protocol generally is what we'll do is we'll figure out, okay, maybe it's your shoulder. We have an ultrasound on premise, so we can kind of take a look to get a gauge of where we need to be, and then we'll inject the PRP, you know, your own cells, back into that area that needs help, that needs repair. It could be, you know, something as simple as, you know, just like kind of maybe just a rotator cuff injury, or it could be something like a, you know, meniscal tear, ruptured MCL, you know, almost anything. Now, You want to take about 72 hours to just kind of let it heal and let it rest. One of the things that we do is we try and activate the platelet-rich plasma, which means to kind of thicken it up. We don't want it like really runny and soupy, because if we inject it into your knee and it's very liquidy and you start walking away, it's going to push all that platelet-rich plasma out of your leg. So what we really want to do is try and get it a little bit thicker so that it's sticky and it will adhere to the cell receptors on that damaged tissue. We want the guys to take like 72 hours off if possible. So when we have a fighter come in, we try and get them to come in on a Friday after they do their last morning training session, because these guys are animals. They don't want to quit. A great example would be Chaz Skelly. And I spoke to him, and he's like, I asked a couple guys, I'm like, hey, if I go on this podcast, is it cool if I, like talk about my experience with you? And they're all like, absolutely, bro. But Chaz, it was funny. We took care of Chaz before one of his last fights, and it's like 72 hours, please don't do anything. And so I get a call like 2 hours later from him. He's like, hey, could you find out from the doctor if it's okay if I just go on a light bike ride? And I'm like, light bike ride? He's like, yeah, I usually do like a 25-mile ride. And the doctor like nearly lost his mind. He's like, no, like, what the hell's wrong? Like, no activity doesn't mean a 25-mile bike ride. What the hell's wrong with these guys? I was like, Doc, you have to understand, fighters can't take 72 hours still. Kamaru Usman, it's like, hey, take 72 hours off. The next afternoon, I saw him like riding the stationary bike. It's just like these guys, they just have it. That's their routine. They have to do it. What is your opponent doing? That mentality. So you always have to.
They're hungry, man. I know you've been in martial arts for a long time, and you're around fighters a lot. How do they respond if you suggest them that PRP might be a way to deal with their injuries?
So actually, most of them approach us, which is great. Once the results were apparent, once these guys started seeing, the injuries getting healed, and we have some really good coaches that are, in our corner too, backing us up. I know Dr. Corey Peacock and Phil Daru will sometimes say, yeah, you guys got to try PRP to some of the fighters that have injuries. And I'll get a call from, like Corey, he'd be like, hey, I got this guy, he got hurt. Or Danny Valentine, is a good friend of mine at the Combat Club. He's one of the owners. He'll be like, oh, bro, he's like, Andre, Sukumtath, he really like messed up his knee. And that was another one. Andre, about 4 or 5 weeks before his last fight against O'Malley, he had a ruptured MCL. And a lot of people don't know. But during practice, I don't know who it was, but a couple guys basically slammed into the side of his leg, and he ruptured his MCL. So he was in really bad shape, but he knew that fight was, for him, that was a huge opportunity, and he hell or high water, he was going to fight. So he came in like, a day later, we did the PRP on him, and, he said, he was one of the nicest guys that you will ever meet. All these guys are phenomenal, but you want to talk about someone who was just appreciative. And he told me, he's like, bro, if it wasn't for the PRP, I would not have been able to get through and finish the fight camp and take that fight. He's like, it got me through the fight. But if you actually watch the fight, the first round, they started kicking him in his knees. Are you kidding me? I'm like, no. But they knew, somehow they knew he had a leg injury prior to that. And even Joe Rogan, they're like, something's wrong with Andre's leg. And then later they're like, all right, he seems to have recovered, and he said, he's like, man, if it wasn't for the PRP, that would have been it. It really helped him out. So a couple of them, in the beginning, they were a little concerned. They're like, well, is this okay? Is this legal? Can we do this? I had reached out to USADA, like I had mentioned to you guys, and because I wanted to make sure, I knew it's I'd heard it's legal, but let's find out directly from the horse's mouth what the story is. And they were, like, as long as you guys are using it so that you can return a fighter back to pre-fight injury status, then it's good. So that was generally the gist of it. As long as you're not using the PRP for, some type of performance enhancement, then you're okay. It's weird. It was a really weird, like idea. Like, how are you going to use PRP to enhance the performance, and essentially you can't, but we'll get into that later. But, once, you tell these guys, listen, this is good, it's legal, this is going to help you. And once, you have their coaches that are kind of behind them and just, really supportive, like, hey, you need to get this done, this could really help. They usually reach out to us and they come in, and, it's been great working with them, because, they're some of the best people, on earth. And you wouldn't think that, unless you're in the martial arts, world, you really don't know how like most of these MMA fighters, the professionals, at least, are just some of the most down to earth, humble guys. Mm-hmm. They have like next to no stress. Yeah. They're great, Absolutely. Great people. And it blows you away when you see, and that's what that's what Dr. Sigmund couldn't figure this out. He's like, because I would show him videos. I'm like, huh, you got to check out this video of Kamaru Usman just pummeling someone and just daylights out of them. And then he comes in and he's got his daughter, and he's just like the greatest father, and he's just so soft spoken and such a smart guy. You're just like, this is unbelievable. And then you see him in the ring, and he's a savage. All those guys. Chess is another one. I mean, this guy's just. These guys are killers. And then, after the hurricane in flooded Houston, guy gets in his truck, drives to Houston, and gets in a boat and starts rescuing people. That guy was, for a week straight delivering water and just rescuing people and just volunteering. They are honestly some of the best people you'll ever meet in your life, and guys that you really want to work with. So for me, it's been an absolute pleasure, and I can't tell you how blessed I feel being able to work with these guys. But they are, anytime you talk to a fighter and there's any type of injection, they are like, what kind of injection? Because they, the last thing they need is their reputation, sullied
Right.
and suspended. And it's always better if, you're not sure, err on the side of caution. USADA was unbelievably receptive. You reach out to them and they got back right away. Mm-hmm. And answering questions, because they want people to be able to compete and they want them to do it the right way. So, if they're going to suspend people, they're at least, going to make sure that they do their job in educating people so that, they're playing their part in keeping, sports safe and, fair. And that's good. So I got to give them credit for that. And all the fighters I've dealt with, they were really concerned with what was legal, but once they know that it's good and it's approved and it works, they come to us, and that's been great. So
now a PRP, from the research I was able to do, and I see it's at least been something that's been in use since the early 90s and maybe even earlier. There are studies that show PRP not having notable effects on various injuries. I've seen some weird stuff in some of the studies, like it was on a sprained ankle and it really did work, or like hair growth. Like, is PRP a treatment for like more specific sort of ailments in your opinion? Not just for everything. It's not like a miracle cure. It's for certain kind of athletic injuries.
Mm-hmm. So the funny thing is, there's literally thousands. There's over 19,000 studies that have been done on PRP. Some good, some bad. Some double blind, some not. Some done on 4 people, some done on much larger audiences. But in terms of how effective PRP is, and this is one of the issues why right now it's still considered quote unquote experimental and not covered by insurance, is because there's no real standardized method that you'll see out there. People are using techniques that are, yielding much lower harvests of viable cells. Meaning, I know for a fact that the system we use is phenomenal. It has a ton of research done by a gentleman, a PhD named Dr. Mandel. And that's out of out of the Biosciences Research Associates out of Cambridge, Massachusetts. They've done the research on the percentage, and we're getting a 70% yield of platelets. I know that when we produce 8 cc's of pure PRP, there is going to be approximately 8 billion viable cells. Some people, they use a centrifuge and they use these test tubes. they use the wrong type of anticoagulant, and it'll say on the test tubes not to use it to be reintroduced into a human, but people still do it. And the problem with the test tubes is the platelets, when they're at a fixed angle, the blood will actually, it's a centrifuge. It's like that ride that you go to in the circus or the fair. You get stuck on the wall. Well, the blood is going to hit the wall and then slide down when it's spinning in the centrifuge, which spins the blood. And even though we feel glass as smooth, on a microscopic level, it's not. And what it does is it starts to rupture and break apart the cell membrane on these platelets. It's called a platelet slip phenomenon. And so now you're getting platelets that are reintroduced that aren't going to work. They're like ripped apart and damaged. We have a system that prevents that. It's phenomenal. So because you have so many different types of PRP procedures out there on how people are preparing them and how they're doing it, there's no real standardized system in place. It's kind of hard to say, well, like this worked, this didn't, because how did you prepare the PRP? And if you're comparing apples to oranges to bananas, so so that's first off. Second off, the blood, there's so many different cells within the blood that are responsible for healing. So for example, we use platelet-rich plasma, and that works great for ligaments and tendons and cartilage. However, if you get a little bit too much red blood cells, if you don't prepare it the right way and you get a little bit more of the red blood cells, which contains neutrophils and other types of cells that are catabolic, and they actually get into the joint itself, it'll actually have a negative effect, and it'll start to deteriorate and actually hurt the person. So if you don't know what you're doing, and a lot of people don't know what they're doing, you can actually do some damage. So what we found is that if you do it the right way, cartilage and tendon injuries, arthritis, osteoarthritis, tennis elbow, golf elbow, those seem to work really well. If you want to do a non-bone union, so say you have like a fracture that's not healing right, then you're going to have to prepare it a little bit differently. That's when studies have suggested those other cells could come into play. So to really, I guess, to effectively perform PRP, you have to know what you're doing, do it the right way, have a doctor that knows where he's injecting, what he's injecting, have a medical team behind you that has experience with PRP. Otherwise, it's a crapshoot. So there's definitely some studies that suggest it doesn't work for this, for that, the other thing. But for all the research that we've done, when you do PRP the right way, it is very effective. Now, if you have a total tear, is it going to cure you? No, it's not. It's not going to fix everything. And what the doc always says is, he goes, PRP, if done the right way, it can't hurt you. It can only help. How much? We don't know. So we've seen people that may need 2 injections, 2 procedures. Herbert Burns is a good example. He tore some musculature. I think it may have been his hamstring. This may have been a year back. And I mean, he was having a hard time. He was in bad shape. So it was behind his knee. I guess it was where his hamstring was connecting down to his tib fib. And I'd have to double check the charts in my anatomy. But the doctor did it, and we saw him, and we're like, "How are you doing?" He's like, good, so much better. I think I'm about 60%, 70% better. He's like, I think I may need another PRP. So he came in, and then he did round 2, and that was it. And then he was back, and he's on a tear again. I
got a quick question. I mean, and that's interesting you bring it up. Would you say that PRP is like a great alternative? Because you see so many athletes that they don't want to have surgery because they say, you get surgery, you're never quite the same, and your body's never quite the same. Mm-hmm. Is PRP like a very legitimate option for an athlete so they can avoid surgery because you can heal your body naturally?
For a lot of people, yeah, but obviously it's really gonna depend on the severity of the injuries. So if you find that you have one of those gruesome injuries where there's a total detachment of a tendon, or I mean, you may need surgery. The fact of the matter is, it's, for some people, it's not necessarily an option, but for what we've seen, a lot of these guys having happen. I mean, just they're coming in, they're getting PRP, for some of these partial tears, micro tears, because what you're also seeing is a lot of times when you have an injury, it's not just the damage of like, wow, the ACL, is damaged. There's a lot of, in the course of why he got that injury or she got that injury, there may have been, maybe they're putting a heel hook or they got kicked in the knee. There's going to be a lot of structural damage around that's smaller, that's not really noticed. So the PRP has a funny way of healing some of that injury as well. Some of the things that didn't really show up because that wasn't the chief complaint that the fighter or the athlete had. So when you do it the right way, PRP can, affect not just that site, but those little smaller things. So that's why a lot of times people are like, man, I feel even better. I would, before I went under the knife, if I was an athlete, if, I could avoid it, I certainly would. And, PRP is a great, that's a great first step. Let's try that. And that's why so many athletes now, like Major League Baseball players, football players, basketball players, the first thing that they do is they'll like, okay, we're going to do PRP instead of doing surgery in the middle of the season. And then off season, maybe we'll go and clean up the area, clean up the shoulder. So, it's, as it turns out, it's really it's starting to take off because of its efficiency and how effective it is.
Now the next question I have, I'm going to save it for Dr. Sigmund when we eventually get to talk to him. But I still want to bring up what kind of brought us all together to set up this podcast, and it's you emailed USADA as you mentioned a little bit earlier, and you got to talk to the athlete biological passport manager of USADA named Adam Bihari, and you were asking about PRP and is it clearable for USADA. Now, his response to you was, according to WADA regulations, PRP is not prohibited, but individual growth factors are still prohibited when given separately as purified samples per S25 of the WADA prohibited list. Now, however, we cannot 100% approve PRP since PRP therapy is prohibited if it offers performance-enhancing effects or if the PRP was altered in a way that can produce performance-enhancing benefits. Thus, the only use of PRP therapy should be the restoration of pre-injury level of function. Now, my question, I'll say for Dr. Sigmund, but I like Paulie's question on the same quote. Paulie, you can take it with that next question because I'm interested in the answer.
Yeah, I mean, specifically when he mentions restoration of pre-injury level of function, is there any evidence at all that PRP can actually improve the body beyond its baseline?
So yeah, I've never heard of that happening, but you have to realize from USADA's perspective, when you start talking about regenerative medicine, which is what PRP and then stem cell therapy is, it's causing a replication of cells. And the research on stem cell therapy, for example, is just starting to accelerate. They've opened up regulations within the U.S. and now we're having more and more clinics that are popping up that are doing adult stem cell therapy, which means they take your fat, they'll do a little liposuction, or they will drill into your hip bone and drill and suction out some of your bone marrow. And they'll basically do the same process for PRP, but they'll extract the adult stem cells. The problem is those cells are only as good as you are. If you're 50 years old, those are 50-year-old stem cells. If you're a smoker and a drinker and you don't exercise, well, neither did your stem cells, so they're only going to be so useful. But if you're a young athlete, then, it's great. And so I think PRP is probably equally as effective as a lot of the adult stem cell therapy. But because it is your own tissue, you are actually allowed to, you can do pretty much whatever you want with your own tissue. So you can do like a systemic stem cell IV infusion, and that has benefits. But the real winner is going to be the embryonic or the umbilical cord blood cells. So on what USADA was thinking, and I'm sure this is what they're thinking, is, as science progresses, they may come up with a way to genetically modify some of these stem cells so that if you were to inject the PRP with some stem cells that have the ability to regenerate muscle tissue, now all of a sudden you're injecting these guys and now it's causing their muscle to grow. It's a legitimate possibility in the future that we're going to be able to do that, because I know for the difference between an umbilical cell and a adult stem cell is that the umbilical stem cells can reproduce 90 times within a 24 to 36 hour period in a laboratory setting. The adult stem cells can reproduce themselves once every few days. So there's a major difference. Now, if you can reproduce cells that quickly and you can target them to reproduce whatever type of cell you want, well, that has some, that can raise some very serious ethical issues from USADA and WADA's point of view. As it turns out with PRP, you're not going to get someone to heal that fast, that quickly. Our body, like our damaged tissue, only has so many receptors that the PRP can work on. It's kind of like a movie theater in the sense that there's a limited number of seats. So once it's full, you're not going to be able to fit any more in. And once they start doing their work, they're all busy. There's no more work to be found. You're not going to generate superstructures of ligaments. You're only going to repair the damage that's done. So, for example, of what they were prohibiting by the individual addition of growth factors, from my understanding, the use of umbilical stem cells mixed in with PRP is prohibitive, and it's actually, I guess, from the FDA standpoint, it is now considered a drug. It's not your own. If it's your own cells, from your fat or your bone marrow, that's not a drug. But because you are now taking another organisms, another human cells, you mix that together. They consider that it's I think a combination of a transplant, a tissue transplant, and a new pharmaceutical agent. So they consider like a drug. So you have to be very careful what you're doing. So it's important that, when you're in this space, that you understand, like, just something as simple as adding stem cells. Now all of a sudden you saw is like, whoa, hey, time out, guys. That's bad. How they would catch you, I think, is one of those things they would have to kind of catch you in the act. But nonetheless, our doctor is really, he always says, I don't want to do anything that's going to get these guys in trouble. And me too. The last thing I would want to do is just all of a sudden we did something, and next thing you know, like Volkan Ozdemir's fights off because we screwed up and added like a vitamin substitute or amino acids into the PRP to help accelerate the healing. That would crush us. No fighters. Yeah, no fighters would ever trust us. But it's interesting.
Let me ask you this, Tim. How do you guys actually measure improvement, and how long does the PRP treatment actually take? Is it a process, recurring after the initial treatment?
So there's a couple different ways that you can do PRP, but for us, the best way that we prefer to do is the one that's going to yield the best results. So a patient would come in, and then after they fill out their paperwork, and we actually get to brass tacks, our nurse will draw their blood, and we draw about 50 cc's of their blood. We mix it with an anticoagulant, or else it'd start to congeal. We need it to pretty much stay fluid. We'll then spin it. We'll put it in a special. It's a closed system, so the blood really never sees the light of day, so to speak. It goes from their vein through a butterfly tube into a collecting syringe. From that syringe, it attaches through a port directly to a blood collection container that we then spin down. After we spin that down, we extract the platelet plasma solution, put it into another container, so it's never exposed to any type of outside pathogens or really even very much air. Because we want to, eliminate as much as possible any potential risk of infection or introduction to any type of pathogens into the body. So we spin it for about a minute and a half, and then after that, we remove, the plasma. We spin that again for 5 minutes. Then once we have that solution, we'll inject that into a series of individual syringes and needles, depending on what we're treating. We numb up the patient with a little bit of lidocaine, a little bit of ethyl chloride, so they don't feel the injections. And depending on where they are, we'll do a little. We have the ultrasound that we can use for the patients that we need to, so that it could be guided. And I mean, if we do it fast, you could be in and out in theory in 30 to 45 minutes tops. The problem
is it just one treatment then? You had mentioned like one of the guys came back with two
Gilbert
treatments.
Burns.
It's-
I mean, Herbert
it's
Burns.
tip-
Herberto.
It's typically
Herbert. Yeah.
one treatment, and then again, I'm curious about how are they just self-reporting? Like, how is improvement measured? Is it that I feel better, and if they're saying they feel better, what does that time frame look like?
So what we've seen, and everyone's different. It's really funny because the process of healing is different for a lot of people, but I've seen some patterns that make a lot of sense. So some people we've seen improve within a week, and I find that the people that improve really quickly like that, a lot of times it's because of like neuropathy. Maybe they had some type of nerve impingement. Like someone got put in a neck crank and now all of a sudden their toes tingle. So they're like, man, I still have pain in my neck over here, but now it's like radiating down through the dermatomes. Like now it's like I feel that tingly sensation. So we'll do a little bit of the PRP injection on them, and usually within a week, it just seems to kind of work really well on the nervous tissue in those situations. We've had guys with herniated discs, bulging discs, and next thing you know, they're a week later, we had a firefighter, a jiu-jitsu guy who was a firefighter down in Miami. Within a week, he said that the pain was like unbearable. On a scale of 1 to 10, how effective it is, he said it was a 9 within a week. It was affecting his performance at work. So that's like best case scenario. Then you got someone like Gilbert, 2 weeks. Usually you'll find healing will take a week or two up to 6 weeks to really notice how much of an effect. Now, the way you could measure is, I mean, if you go to a physical therapist, they're going to start to, check your range of motion. How much of an improvement is your range of motion? So our doctor he'll go through and he'll check, okay, what was the degree of mobility that you gained in terms of like, now can you lift your arm this high? All right, now how much more? If it's a tendon or a ligament, that's a little bit harder to measure because now you have to kind of involve an MRI and start to take measurements like how much improvement, how much growth. And that's something that I would really like to see. It's kind of hard to do in a limited outpatient clinical setting to actually measure these things. But if you have, a nice grant and a good facility, you could really do some really, really comprehensive tests to actually see, all right, what percentage improvement was there in terms of cellular regrowth.
Sure,
obviously
that would be some amazing data.
Yeah, and the problem is, your data is only going to be as good as your population of the study. How many people did you actually study? If you've got a small group, well, the values aren't going to be that significant. I'm not going to give it too much credibility, but if you can, reproduce the results. So for me, I would say I think really honestly with this, the proof is in the pudding. Either you do or you don't. If you're a fighter and all of a sudden, you're like, you know what, 5 weeks later, I'm now in the octagon on pay-per-view fighting people and I'm feeling good. And I'm, I just went the distance and, just knocked this guy out. You know what, maybe there's something to it. I think it was pretty successful. Because we're talking about guys that are coming in that are like, man, I can't train. Like Andre was, for example, was terrified that he wasn't going to be able to fight. And I know Volkan Ozdemir. That was, he's another one. People don't realize that when he fought Cormier, a few weeks before his fight, his hand was, it was horrific. His power hand. He wasn't, he wasn't able to really train because he had, some serious, damage in his hand. But that guy, he came in, he got some PRP, and he said it really helped with the inflammation, and it helped him, take that fight. But that guy is one of the toughest. He's one of the nicest guys you'll ever meet. I mean, here he was, the number 2 ranked guy in the world, and he would go out of his way to come up and shake your hand and, introduce himself to everyone in the gym, just so polite. And but that guy's heart, he said he's like no matter what, he's like, this is the opportunity of my life. No matter what, I'm going to be taking that fight. And he is I mean, I'm just in awe of that guy's his work ethic and what a good dude he is. But when you see these guys, like from with the injuries that they have to how they're performing, it's a really good judge of how effective it is as a treatment. So.
I mean, if organizations like USADA and WADA aren't confident, or even sanctioning bodies, state sanctioning bodies, or maybe that they have some apprehension on PRP and fully embracing it and spreading the word. I mean, what sort of awareness needs to be conveyed to these bodies to make them confident in allowing this and pushing this and getting more fighters involved with this? And make it a helpful medical procedure, because that's what it seems like. It can really extend a career, or make a fight happen that might have been canceled. Like, what do these people need to know if they're out there reading these stories about maybe negative results and not understanding, like what you just explained great earlier about how to do it? What are key things they need to know to understand this is a very useful treatment?
I think one of the biggest issues is just you have to eliminate the charlatans and the people that are actually, I guess, doing things that are going to be detrimental for the fighters. So that's first and foremost, because if they're doing something illegal, then that needs to be exposed so that it can really be, I guess, further introduced to the fighters and the coaches and the gyms as a positive, viable, appropriate, and legitimate legal alternative and solution to some of these injuries and surgeries. So it's really just about educating the actual process. And the reason that is difficult is, like I said before, if I go to 5 different doctors that do PRP and I say, hey, how do you do it? I guarantee I will see 5 different methods. So it's kind of hard to legitimize any type of medical technique that, like, for example, if I said, hey, you're gonna have a root canal, or hey, we're gonna get your appendix out. Generally, the procedure is gonna be the same. If you're having any type of medication, that medicine is going to be exact chemical formulas. But PRP, it's like you don't know what percentage of cells, what total volume, the concentration methods, the procedure. There's just so many questions. There's so much out there in terms of it being just unregulated in terms of the standard, the practice of care, that it's kind of hard. But if you can, get behind and say, hey, this is what real PRP is, these are what the actual numbers are, and these are some legitimate providers that do it, then I think more people are going to become more aware of it. But I'll tell you what I have seen in the past, year and a half in terms of awareness. More and more people are learning about it, know about it, heard of it, and are starting to realize other benefits. Because it's not just also for the orthopedics. We have a lot of women that'll come in for facial rejuvenation because it helps the collagen cells under your skin grow, or even for hair loss. We've actually seen people start to regrow hair, guys in their 40s, which is it's amazing. I would have never thought that would have worked, and if I had not seen it with my own eyes. But as long as there's an educational campaign done on behalf of legitimate practitioners and medical providers that showcase, hey, this is how it's done, this is how we're doing it, and this is what we're not doing, which would make it illegal by performance enhancing standards, then I think everyone would be like, hey, listen, this is the way to go. Because like you said, I've seen it save several fights. I've seen injuries about a month out that were able to be healed enough for that fighter to come in and be competitive. So without PRP, I know of at least half a dozen fights that would not have occurred. So it saves fights, it saves cards, and it's just, for a promoter and an organization, for a coach, a team, a fighter, it's really it's a valuable tool to have in your pocket.
That's pretty much all the questions for us. Let people know out there, where some of the websites where they can find NovaGenix, learn more about the clinic, the other things you offer, anything on the NovaGenix on Facebook, on Twitter, any social source. Let anybody out there who's interested, especially in the Florida area, who want to now go to the clinic, let them know all about that stuff.
Yeah, we're right now, our main clinic is in Jupiter. We're actually opening up our second location in Fort Lauderdale in just a couple of weeks. So we're in Palm Beach and Broward County. The support we've gotten has been tremendous. Our website is NovaGenix, NovaGenix.org. You know, you go on there and you could see a lot about what we do because, you know, we do a lot of hormone replacement therapy. And, you know, that's obviously banned. You're not really allowed to do testosterone. But, you know, we got a lot of guys that are, you know, 40, 50, 60-year-old guys that, you know, still want to do jiu-jitsu, but, you know, they manage, don't have the energy, you know, like, you know, in terms of like, you know, recovery, you know, just muscle development, fat, you know, it's been tough for them. And then, you know, they get tested and all of a sudden their blood levels their testosterone's like, you know, 240. So they'll do TRT and it just helps them be healthier because now they're active again. You know, testosterone doesn't turn people into, you know, like freak bodybuilders. It turns them into like leaner, happier, more active individuals.
Do they come and ask Andy to help straighten out their Longfellow?
You know,
I've never heard that Longfellow. Showing the age, Paulie. Showing the age.
I'll tell you. I call Andy. My nickname for him is the Penis Whisperer. You know, because he's the guy. He's the guy that has to go in and work with some of these guys. But yeah, that's certainly another area that we work in. But you know, most of the guys, it's funny. They, you know, the PRP, you know, people are like, yeah, you know, they love to promote it and they love to talk about it. The TRT, it's funny. Testosterone and erectile dysfunction medication in men, a lot of times they don't want to be that open about it. And it's funny because a friend of mine up in New York, he's a firefighter, and he says, you know, he's like, a lot of the firefighters are now on like testosterone, and like that's the big thing. They go around the gym, they're like, yo, would you get tested? You're on T? What's your level? You know, and the guy will be like, it's like 260. They're like, 260? Ah, this guy's a joke. He's only 260. You know, so it's I thought that was great, but we do. You know, hormone therapy for women too. And, you know, so a lot of times, you know, women get older, they're starting to get hot flashes and, you know, there's help for them out there. The weight loss programs that we have has been, you know, phenomenally successful because, you know, if you're a mother of 2 or 3, or if you're a father and you got a job, you just don't have the time or the energy to like go to the gym, or maybe you go a couple days a week and you're like, man, I'm just not seeing the results. I diet, I try and exercise, but my metabolism. So we have some programs that'll help, you know, kind of kickstart your metabolism so you can, you know, shed 20, 30 pounds in a short period of time. And that might be just what you needed to sort of get your metabolism going again and get to where you need to be, because chronic obesity is a huge problem in the U.S. It leads to a lot of other problems. But really, the stem cell therapy that we do is incredible because we're using the umbilical cord cells, and the results that we've seen have been, you know, just unbelievable. You know, the PRP has been phenomenal. So we're starting to grow. We're looking at opening up a 3rd and 4th location, hopefully within the next year as well. We have a couple of locations in the works, so I don't want to jinx it yet, but it's been really it's been great working with, you know, just phenomenal people, and you know, just being able to work within, you know, it's like a dream come true, you know, like as a jiu-jitsu guy, you know, I've been doing martial arts, you know, for over half my life. Absolutely love it. Get to work with like the best fighters and coaches and trainers in the world, because, you know, I talked about a lot of the professional fighters that we worked with, you know, but I never, you know, I mean, there's a lot of jiu-jitsu black belt instructors that come in for treatments of all different sorts. And, you know, just to be able to like help people within the community, and then like they send some of their students. So we've worked with just, you know, tremendously supportive people, and just really cool people, authors, lawyers, a lot of other doctors come. So you get to hear a lot of really cool stories, because when people come into a medical clinic, they open up and they tell you some stories, and sometimes that's a good thing, and sometimes it's a very weird thing. It's a very awkward thing, but that's when I have Andy step in and work his magic. So that's, Andy, this one's for you.
I love that guy. He's a good guy.
Oh, he's a nut, and, you know, he sends his regards. You know, but he couldn't make it tonight. But he's such a weird introverted dude anyway that he probably wouldn't have much to say. You know, he would just sort of nod a lot. Like, dude, you
And
can't really nod.
if you're at the Combat Club in the near future, tell my boy Rodney Brewer I said hello.
Rodney is one of the most hilarious individuals I've ever met in my life. And what's funny about Rodney is, you know, like, he is a tank. He is a terrifying individual. And, a quick story about Rodney and the Combat Club is we actually, NovaGenix and the Combat Club, we helped out. And actually, Igor Almeida and Natasha Almeida over at Palm Beach Gardens Martial Arts, we all got together and did a training for the Palm Beach County School Police Department, where we taught all of the Palm Beach County School police officers self-defense and ground combatives, because the last thing you need is to have these guys punching kids. That's because all of a sudden the cell phones come out and now you got a major problem. So we're trying to teach them jiu-jitsu, control. And every single one of those cops, like, you would hear them whisper, they're like, Jesus Christ, look at that fucking guy. He is like hang. And he's just showing, like, he's like, this is how you choke someone. They're like, not sure you're allowed to do that. He's like, all right, well, let's find a different way to choke them. It's like, no, I don't think you get it. But yeah, right.
Wow, man, he's so funny, man. He's a great guy. I cornered him, I think, for his first fight down in the Keys in the rain. It was crazy, man. Just a cool guy, man. I love that guy. Haven't seen him in a long time, but super cool guy.
He's amazing, and one hell of an instructor too. Just a charismatic dude, and he's funny, and just awesome to be around. And he's got this, like, his dog is literally just like him, like built like a refrigerator. But yeah, they're good dudes, and apparently you also know. I think did you say Bruce Gorman was one of your first instructors too?
Oh yeah, Bruce used to beat the crap out of me, man. He broke my nose, back in 1992, I think. And oh yeah, I know he bullied a lot of people. But I love that guy, man. If it wasn't for Bruce, I would have never been fighting.
Bruce
in the world.
Is a scary individual. He's just and he's like the perfect example of why it's awesome to keep on training martial arts, because you see this guy's got white hair, looks a little bit older. If he's wearing a shirt, you don't realize how how jacked he is. Could you imagine some guy trying to rob Bruce? What would have happened? I mean, he's a black belt jiu-jitsu, and like he doesn't even admit to it. Yeah, he's like, I'm more of a strike. He likes punching things, not like grappling, but he will dismember someone. Like, he's terrifying. He is terrifying.
I got so many stories about Bruce. That's for a whole other show, though.
There you go. So, but yeah,
great talking to you tonight, brother.
Absolutely. I definitely appreciate it. And, it's been a blast, and I've been a big fan of this podcast. I'm always liking and sharing your stuff, because I think it's worthwhile, and it's great for the community to have, shows like this. So anytime. And, and if you guys ever get hurt, please come see us. We'll take good care of you.
It'll be tough for me. I'm a little far away in New York.
Hey, listen, this is a beautiful place to come visit. So,
I mean, well, before we go, Paulie, let them know your social, your Twitter, Instagram, Facebook, so people can follow you as well.
Oh, follow me at Dr. Paulie Gloves on Instagram and Twitter. Connect me on Facebook. Hit me up on LinkedIn, Paul Gavoni, and check out my articles on Bloody Elbow. I write a fight science series. If you want to learn about accelerating performance or coaching or being a better fighter, check out those articles. They're pretty cool.
All right, for me,
I was just gonna.
Yeah. Say go ahead.
I was just gonna say, I don't even know what like half of my Facebook. I mean, like he had that ready. Like, I feel like a tool, but I know we're on Facebook. I believe it's like NovaGenix Jupiter and NovaGenix Fort Lauderdale, and I know we've got Twitter and Instagram. Yeah. So you just look up NovaGenix Jupiter or NovaGenix Fort Lauderdale, you'll find us. But other than that, man, I should probably write that stuff down for the future.
For me, you can follow me on Twitter, Cheapsies Chat, on Instagram, Jericho Vedetta, and of course, you can follow the show on Fight Strength on Facebook, on Twitter, Fight Strength _. Remember, as mentioned before, you can find all our previous episodes on Spotify, SoundCloud, Google Play Music, Player FM, iTunes, iHeartRadio. Big thank you again to Tim Bruce for coming on the show this week. I am Jason Burgos. He is filling in for Phil, guest host Paul Gavoni, Dr. Gloves. Until next time, everybody. Bye-bye.